what we've learned over the past 10 years is that the unique sensitivity in lung cancer to tyrosine kinase inhibitors is driven by the presence of EGFR mutations, by changes in the EGFR gene. And one of the big questions that we get now is, well, you do a mutational profile, how do you actually treat patients based on the individual mutation that you find? Most of the mutations that we deal with are common mutations, so exon 19, exon 21, common mutations. However, about 11% are more uncommon mutations. So a question a practitioner asks is, do I treat the uncommon mutations the same way as the common mutations? What we reviewed today at the Chemotherapy Symposium is we reviewed how we treat common mutations with tyrosine kinase inhibitors, including gefitinib, afatinib, and erlotinib, and then how we use that information to treat more uncommon mutations. And if you have, for example, a T790M mutation at diagnosis, one would argue that you probably want to be looking at one of the more modern, newer T790M specific drugs. And if you have some of the rarer exon 18 or exon 20 mutations, you might want to look at a slightly different option because not all of those mutations confer sensitivity to tyrosine kinases.